you so much. And yes, thank you, one, to the county for providing these dental Cs, and two, thank you for all the dentists and oral health professionals who have joined us today. Please pass this along to your friends. We know how important dentists are in public health, so this is amazing to see everyone. So, for my dental updates, I decided with the holidays here, we're seeing a lot more dental trauma, and that's because kids are getting bikes and they're getting, oh my goodness, hoverboards are the worst. Scooters, trampolines. Trampolines are also one of the top worst things for dental trauma, by the way. So many teeth avulsed. So I thought I would go over what to do if a tooth is avulsed or knocked out during the holiday season, since most of the patients that we treat among ourselves in this community are more likely to go to urgent care or the emergency room rather than their local dental office for treatment. So for those on the call, you know what to do if the patient comes to your office or how to triage it over the phone. So the first thing I really want to point out is that treating a tooth that is knocked out, it's really time sensitive. You have about an hour. After an hour, the prognosis of that tooth goes significantly down. So remember, if someone shows up in your urgent care or ED, please take care of the really, really, really urgent patients first, please. But then if you do have somebody who has a tooth sitting in a cup of milk in the waiting room, maybe send a nurse or someone out there just to stick it back in the socket until you get around to seeing them, because that would just make a huge difference for that patient. But what you're going to do is you're going to first make sure it's a permanent tooth. So that's pretty much going to be anyone probably starting around the age of 6, most likely more 7 or 8, but go with 6. If they're 4 or 5 years old, most likely it's a baby tooth. Usually the parents can tell you, but sometimes they can't. You want to, so we don't want to reimplant baby teeth. So make sure it's a permanent tooth. You want to pick it up by the crown of the tooth. So that's the white portion that you see. And you want, if it fell on a pile of dirt, say it was baseball and it fell on the, the home base or something and it's dirty, you want to rinse it gently off either milk or saline, or most people don't have that. So water's fine, though it's the least that you want to do, but rinse it off gently. Do not scrub it. We want those cells on the root of the teeth to be alive when we reimplant it. So if you sit there and scrub all that dirt off, the tooth is a goner. You can gently rinse some of the debris off of it. If it fell on a pretty clean surface like the kitchen floor or something like that, then I wouldn't rinse it at all. Your body can handle it. So pick it up by the crown of the tooth. You want to either yourself, if you're there, or if you're talking to someone over the phone who's calling your clinic, you want to tell them to pick it up and just stick it back exactly where it came out of. Don't worry too much if it's forward or backwards or turned around. The dentist can fix that. So don't sit there and stress whether or not the tooth is facing the right direction. We can worry about that later in the dental clinic. The important part is to get it back into the hole it came out of. And then you want to have the patient bite on a piece of gauze or napkin or something to hold it in place until you're able to get them over to a dental office. So if you're not, this is a pretty clean avulsion. You can see that the patient holding it by the crown of the tooth, the white portion, they're just sticking it right back in the hole. Oftentimes, the avulsion is not this clean. There's going to be a lacerated lip, maybe a lacerated tongue. Even the bone around the bone can be fractured. Do your best to still try to stick it back up into that socket. If it's not able to be done, we want to make sure that tooth doesn't get dehydrated out. So an order of preference would be milk, if available. There are save the tooth kits that a lot of nurses' office has with Hank's and salt solution in it. That's second best. Patient's own saliva. So if you get them to spit into a cup, or even putting the tooth in the side of their cheek, as long as you know they're not going to swallow it, will help, or saline. Water is a poor choice, but it's better than nothing. So if all you have around is stick it in a cup of water. When the patient does come into the clinic, hopefully the tooth is stuck back up in there. But if it isn't, first thing you want to do is make sure the tooth is back up in the socket. And then you want to make sure that the patient is up to date on their tetanus shots. So make sure that they're up to date in their immunization and their boosters. Obviously, make sure the patient doesn't have any other serious injuries like head injuries and broken bones and things like that. And then you do want to give them systemic antibiotics. So amoxicillin and penicillin are the first choice. For those 12 or older, doxycycline has actually been shown to be best. It actually prevents some of the osteoclast activity that may reabsorb the root of the tooth. But either of those, and then you want to make sure that they get over to a dentist as soon as possible. I think that's all I have to share today. So if any people have any questions about how to save a tooth over the holiday season, just let me know. But honestly, it's really easy. Pick it up, gently clean it off, and stick it right back up in there and call your local dentist.